Now, as I said before, we have Dr. Kwame Edu-Bonsafo, who is a senior specialist and gynecologist at Kolebu Teaching Hospital, and today he's going to be educating us some more about candidiasis. Good morning, Doc.
Good morning.
How are you?
I'm fine, thank you.
Great. Doc, first question I want to put to you is because we already have this, conception that it is a female ailment. Who's more prone to getting candidiasis?
Well, to start with, candida or candidiasis is just a yeast infection or fungal infection, and to be able to talk about which people are prone to getting the infection, I think first of all we have to understand some basics with this kind of infection, and what goes into it is that candida is a microorganism that we cannot use our eyes to see, but it forms part of what we call normal flora. That is, if you look at our system, our skin, the nose, the ears, the throat, from the mouth to the rectum or the anus, and then in our private part, we have microorganism bacteria, which we call them as useful bacteria.
So, like good bacteria.
Good bacteria,
right?
It's because they help us, and then we have bad bacteria. So, candida is one of the these fungus that can cause that are considered as good in quote.
Okay.
And so there's a balance in the skin or wherever these organisms are. Mm-hmm. Anytime there's an imbalance, say that the level of the good bacteria sort of go down, and then the candida goes up, then you get an infection.
Okay.
And so then the balance is what will, if you get an imbalance, then that will sort of head towards a person being prone to having the infection. Okay. So, for instance, people who take antibiotics, sometimes not prescribed, they get a little fever or some form of cough, and they want to take antibiotics. Mm-hmm. This can cause eradication of the normal bacteria,
okay, and
therefore the candida can now get opportunity to overgrow and cause symptoms.
Okay.
Also, people who have immunosuppression like HIV/AIDS, people
right,
who are having cancer and therefore are taking some medication for the cancer treatment can also have this problem.
Okay. So like retroviral agents,
yes,
radioactive procedures,
and then chemotherapy, the drugs that we use to treat those with cancer. And then also people who have diabetes and it has not been well controlled, those can also have problems. People have mentioned things like oral contraceptive drugs, because those who have high levels of estrogen may cause a predisposition, but currently the oral contraceptive that we have low levels of this. So these are some of the things that can cause predisposition.
So chemical hormonal imbalances.
Yeah,
that's more.
Can
okay. Now, a lot of people consider candidiasis or candida to be thrush. Is that the case, or is there a difference between the two?
Yeah, well, if you look at it too, they are really talking about the same thing, just that candida is more of scientific sort of term, and thrush is just a localized.
Okay, so they are actually the same.
They are all yeast infections and can occur in any part of the body.
Okay, all right. Now, does eating a lot of sugar or sweet, rich foods cause candidiasis?
Well, looking at it, this has been a sort of a lot of controversy. People have talked about it, but truly, if you just eat sugary food, you are not going to get candidiasis. It is linked to diabetes. Sort of, if you have your diabetes is not well controlled, then you have high levels of sugar, and then the candida will sort of feed on it and then overgrow. And that is why people say that if you just have a binge of sugary food, it's not going to cause any candida.
Okay. Now, there's a relationship between candidiasis and the fact that it's thought to be a feminine disease. Now, men can actually contract candidiasis, is that correct?
Yeah, men can also get candidiasis. As I said, candida can occur in any part of the body. Right. And looking at candida occurring on the male genital organ, it can occur if a partner of a woman who has been having a recurrent sort of infection, they are prone to having this organism colonize on the genital organ, and those people are sort of about 4 times higher than people whose partners don't have this kind of infection. Okay,
so it is transmittable then? It is.
Traditionally, candidiasis is not a sexually transmitted infection. However, if a patient, a person whose partner has had this recurrent infection is having it on the genitalia, can be transmitted.
Right.
And then this is also more common in people who have not been, men who have not been sort of circumcised, and they can harbor this organism in the prepuce, and this can be sort of transmitted to ladies. But traditionally, this is not a sexually transmitted disease.
Okay. So in general, I mean, how best should we go about trying to prevent or not contract candidiasis in our day-to-day lives?
Well, looking at it, I think we should look at, we have mentioned some of the predispositions, sort of risk factors, and we have to look at them. Not taking any antibiotics anyhow, you have to see a doctor. If you have any infection, anything you want to take a drug, I think you should see a doctor first. Because taking antibiotics in some women can cause or can predispose them to having this candidiasis. In some cases, if you want to take antibiotics, it's recommended that you see a doctor who will prescribe antifungal for you to take during the period or just after you finish the treatment. And then if you have diabetes, then it means you have to sort of see your doctor for it to be well controlled. And then also, you know, Candida is sort of the infection occurs more in people or in areas of our body where there's more moisture, and also where there's a lot of warmth, and then airless places. So you can look at it in this in terms of having vaginal candidiasis, especially if you sit for a very long time, obese people and all that. Yes, those kind of things. So we have to look at all those things, and then we should try and be wearing cotton panties and all that, and underwears. These are sort of basic things that we all know that can help with terms of prevention.
What's the treatment for candidiasis? I mean, you mentioned antifungal, but in general, what would you prescribe or what would you advise in order to treat?
Well, if you think you have candidiasis, the reason is most women think they have candidiasis when they don't really have the candidiasis.
Why do they think that?
Because most women think that whenever they have itching or vaginal discharge, then that's candidiasis. In fact, a study that was done showed that only about 11% of people who thought they had symptoms of candidiasis actually had candidiasis.
Right.
So you see, you waste your time trying to go to the pharmacy to get drugs to treat yourself. Your itching and all those problems will still continue until you treat it falsely, and then later you go to see a doctor. So first of all, it's advisable that when you see a doctor or your nurse, we examine you, look at the symptom you are having, the kind of discharge you are having. In fact, the commonest cause of vaginal discharge is not candidiasis. So if you have a discharge and you think it's candidiasis, you are sort of not getting it right. So doctor take a sample and then take it to the lab to make sure that what you are having is candidiasis, and then that can be treated. If it is not candidiasis, then the other forms of vaginal discharge can be looked at and treated.
Okay.
So we don't have to be just taking drugs when we think we have. It might not be candidiasis. And
how dangerous is a reoccurrence for somebody who's had it before and treated it?
Well, if you have it before, in fact, if you look at about up to about 70% of people or women will have candidiasis at least once in their lifetime, and about 50% of these people will have a recurrence. But about 5 to 8% of people will have a sort of recurrent infections, and that will mean having infections about 4 or more times in a year. If you have something candidiasis for about 4 or more times in a year, then you are having a recurrence. These things have to be looked at and treated, because it's embarrassing, and then it's irritating, can cause a lot of, and this can cause women to sort of feel uncomfortable. They cannot sort of concentrate on whatever they are doing and all that. So it has to be seen and treated. And looking at the treatment, when you see a doctor, we have lotions, we have creams, we have tablets, depending on what the doctor thinks is appropriate for you at the time, then he or she can really prescribe that for you.
Okay. Doc, I want to thank you for coming in this morning and obviously educating us a lot more about candidiasis.